So your dentist or orthodontist says that your child needs braces, and you're like, what? You have all these questions come into your head, like, well, my child's only 7. Do they really need braces? Or, if I get braces now, will my child still need braces later? Can I just do nothing? Can I just wait? And I've got a bonus question for you at the end, so stay tuned. Let's answer all these questions for you and your child in this video. Don't forget to like and subscribe. Here we go. First, my child's only 7, or maybe younger. Do they really need braces right now? Well, depending on where you're at in the world, providers might recommend a different age. But in the US, the American Association of Orthodontics recommends between the ages of 7 and 8 years old getting your initial consult. Didn't say get treatment, said consult. Between the ages of 7 and 8 years old, get a consult. And that's because we're looking for specific things like underbites, early tooth loss, like early baby tooth loss, ectopic eruption of teeth, a crossbite with a jaw shift, and maybe habit control. So, all these different things. You know what an underbite is? Somebody with an underbite, per the research, the best time to treat this while avoiding surgery or more invasive procedures is between the ages of 6 and 8 on average. Early tooth loss, I just saw this the other day, right? Some child comes in, got a cavity, lost one of these baby teeth in the back. That's a big problem because there's permanent teeth underneath it, but there's also permanent teeth behind it. And so if you lose the baby tooth, the other permanent teeth haven't come in yet, the permanent teeth in the back, and you're like, well, that was a lot of information. Go in for the consult, right? You don't want to lose space as a result of early baby tooth loss. Ectopic eruption, that's another big one. That's what we're looking for. Particularly, you got these permanent canines that can come into poor positions. If you've got a small permanent incisor on either side of your top jaw, you might be at risk for an ectopic canine. Or in addition to that, there are some times where you have permanent 6-year molars that get out of position and lead to early tooth loss. So there's just things like that we look into. In addition, crossbites with the jaw shift. Your jaw shifts to the side. That can be a result of narrow palate or baby teeth that have kind of collapsed in, and we don't want you growing with a shifted jaw all the time, otherwise it could lead to jaw asymmetry. And finally, habit control. Right at this age, people still might be sucking their thumbs. I think I was kind of a thumb sucker. Poor tongue posture, like resting between your teeth all the time. That could, with thumb habit or tongue posture, that could lead to an open bite, developing an open bite with your front teeth, permanent teeth. It's mostly a problem, again, when you're getting into the permanent dentition in the front. But something that you can try and start working on, proper habit control. And finally, airway's a big thing recently. Not recently. Everybody's always needed their airway. But at this age, you could look into things like allergies, removing tonsils and adenoids, being evaluated by a sleep physician or ENT. Those are things that could help, right? At this age. That's why you are evaluated between the ages of 7 and 8 to see if you have any of these conditions that might benefit from early treatment rather than just waiting. But again, the key was consult, right? Between 7 and 8. You don't have to get braces. We're going to answer the next question. Will my child need to get braces later if they get braces now? And the answer is, the honest truth, most people, even with early treatment, can still benefit from some small enhancement to get to what we consider the ideal. So, just because you have early treatment doesn't mean that you won't need later treatment. And the other honest truth is there's no treatment out there that has been proven to, when you do it early, prevents the need for any treatment later. Hence, the answer to the first question. Now, that being said, there are some treatments that, if performed early or earlier, they appear to reduce the complexity or the need for specific procedures later when you're treating it more comprehensively. For example, right, with those ectopic canines, the canines that get out of position and they start maybe, going to behind your teeth. Well, if you do remove baby teeth preemptively, or you do an expander or a headgear, there's just different appliances that you can use, but that's been shown to reduce the risk for impaction. If you don't have impacted teeth, then you may not need to do an expose and bond procedure. Check it out. We've got videos about it, but that's one area where early treatment may reduce the complexity need of future treatment. And of course, the question that's burning in your head, right, is, well, can I just do nothing? Can I just wait? And the answer is yes, yes, yes. Nobody should feel like they have to do treatment. Orthodontic treatment hasn't been proven to extend people's lifespans or even prevent them from ever having any major oral health problems that would lead to like a reduction in your lifespan. Waiting is always an option. You probably want to ask your provider, is it reasonable for us to wait in this situation and do a more definitive treatment later when all of the teeth are in or close to being in and we're going through a major growth spurt to try and resolve bite issues and whatnot? And there's a good chance the answer is yes. Now, that being said, just because you can treat everything later doesn't mean that it's better to treat everything later. For example, if you have a crossbite with a shift, narrow palate, that dimension, right, from side to side, we call it transverse dimension, the width, that dimension of growth is one of the first to stop, right? You've got a suture that runs down the middle of your mouth, and in order to get a sutural split where the suture splits apart, it gets harder and harder as we get older, and so it requires things, more invasive techniques potentially, more pressure in order to get the same kind of results as if you did it earlier. So that's an example of a certain condition that you might want to consider if the early benefit outweighs the benefit of this benefit of early treatment outweighs the benefit of just one later treatment. Somebody mentioned this about a concern about our office, and I think this can apply to lots of offices, is, really there's only two generally accepted phases, an early phase and a more definitive, comprehensive adolescent phase. I mean, there could be other phases, like when you're an adult, if you don't wear your retainer, but people shouldn't think that everybody has to do multiple phases. There's just not the same benefit for everybody. In addition, you always, like we said before, you always have the opportunity to wait. Okay, now for that bonus question. What if my child does get early treatment? Will they have to wear retainers? Anyways, that is a great question. Just so you know, currently, as it relates to the position of the teeth, whether it's wide, tipped forward or back, spaces closed, open, if you do not maintain those positions mechanically, there's a good chance that over time you will see change. So that's a great question to consider. If your 7 or 8-year-old is going through treatment, what are you going to do to hold on to that? Am I ready to help my 7 to 8-year-old wear a retainer of some sort? If I don't want to wear a retainer, am I wasting time and money trying to fix these things? All great questions. You just want to make sure that your goals align with what the treatment is going to provide, and then retention-wise, what's required afterwards. Talk to your provider. They can fill you in. If you still have questions, come find me on this channel or in my office. Leave a comment. I try to respond to those. Just trying to get good information out there to help you as consumers make good choices. That's all I've got. Just a little PFOing so you know where you're going. Packard out.